we talked about our varying cycles, and how they play a role in our fertility. So when would be the best time, like the best time within the whole cycle of your 30 days, 27 days, or whatever, to actually fall pregnant?
The best time is right when the egg is being released from
Mm-hmm.
the ovaries. And there are ways that you can figure that out. So like I said, right around the middle of your cycle, it's different for each person. Some person, it could be day 14, day 12, day 16. But usually somewhere between day 12 and day 16, that's when you'll have the egg being released from the ovaries.
Mm-hmm.
So as soon as that happens, that's when it's good to get the sperm to go in. Now, sperm can stay in the canal for up to 5 days. So if you're with a partner that has very motile sperm, then even 5 days before the egg is released, then the sperm will just stay there. But we're seeing issues with male sperm as the years go on. So I
Mm-hmm.
think it's the environment, the food, the sedentary lifestyle
Mm-hmm.
that's contributing to men having sperm that isn't as motile. So the best thing to do is to buy ovulation strips. And so
Okay.
you just pee on those ovulation strips, or you stick them in a cup with your urine in there. And then it will tell you luteinizing hormone. And luteinizing hormone is a hormone that is released just before your egg is released from the ovaries. So egg is released, then you get the sperm in there and it will meet the egg.
Wonderful stuff. So I don't know if it's normal, but every month I can feel a sharp pain on my side. Sometimes it's on my right side, sometimes it's on my left side. And someone said to me that that's ovulation happening. So can some people actually feel the pain of ovulation?
Yeah, usually um so usually when women have pain during ovulation and it's like really painful, then they probably have a cyst that's there. So do you feel it on both sides?
No, just it alternates from
So
side
you'll
to
feel
side.
the sharp pain on one side 1 month, then the other side the other month.
It's more like a discomfort, where you just feel like this dull ache and then
Yeah,
it goes away.
and
Yeah,
then
it
that
doesn't
goes.
it doesn't linger for too long.
Okay. Yeah, so yes, lots of women can feel that little release, but you shouldn't really feel it unless there's like some inflammation there or just like a little cyst, which cysts come and go. So some women will just develop a cyst when it's time to release, and the cyst will go away. So it's sometimes nothing to worry about. But
Okay.
yeah, some women can feel that little sharp sudden pain that
Hmm.
happens. But if it lingers for a long time, then definitely you have cysts.
Okay.
Not you, but whoever is listening. If it happens, if you feel the pain continue like for an hour or more, then
Yeah.
definitely there's some inflammation, some cysts or something there.
Okay. Awesome. And then lastly, from my list of questions, when is the best time to actually say, okay, you know what? I'm done monitoring this. This isn't making any sense. I now need to talk to the doctor in relation to falling pregnant. When you've done all the things we've talked about, or you've noted all the things we've talked about. When is the best time to actually say that this is no longer working? I need help.
Number one, before you even try to get pregnant, make sure that your menstrual cycle is normal with
Hmm.
the way that I've indicated it. Make sure that it's optimal, I guess is the right word.
Yeah.
So make sure that you don't have any of the symptoms that I've listed before you start getting pregnant. Now, once you start trying, if you cannot get pregnant, which is very, very rare to fix all of your menstrual cycle issues and you cannot get pregnant, I would say that after about 3 to 6 months, then maybe introduce some herbs to
Hmm.
help you with your fertility. And I just recently did a video on my YouTube channel discussing herbs for fertility, and it highlighted one particular one. Um, so I would start introducing some herbs. If that doesn't work after 3 months or so, then I would make some adjustments to continue making adjustments to the diet,
Mm-hmm.
incorporating some full fat yogurt in there for sure, some other fertility boosting foods that I talk about. And if after a year that doesn't work, then definitely you're infertile. So some extra tests and other things need to happen. Here in the
Okay.
U.S., we don't start getting concerned until it's that 1 year.
Okay.
Yeah.
All right.
So usually on the holistic end, I'll work with people. If it's been 3 months, then that's when I'll start with the herbs immediately.
Okay.
Usually that works within the next few months. But if after a year you cannot get pregnant, then you're infertile.
Okay. So on the issue of herbs, right? You and I have had this discussion before. People need to be careful the kind of herbs they actually are consuming. And I think with COVID, people are consuming a lot of stuff because we're trying to be like prophylaxis. Take this, take that, because it'll help you strengthen your immune system, and you don't get sick and the like. But when you and I had a conversation, there was stuff that I was taking which actually affected my menstrual cycle, right? So I think people need to actually know what they're putting into their bodies. And if you're not sure how it affects you, please get in touch with Dr. Vita, because you never know how what you're taking will affect your body, and the ripple effects that it can have on other things that you're trying to do or not trying to do, right? So one last question for me. I realize I didn't put it in here is, can we use our menstrual cycle to actually prevent pregnancy?
Yes, that's what
Mm-hmm.
I do. So I don't use any hormonal contraceptives or even non-hormonal contraceptives. I've always tracked my cycles since the day I got married. I just track my cycle to prevent pregnancy. So the
Okay.
key here is to just not engage in intercourse during ovulation. If you're unsure, I need everyone to be sure of when you ovulate. You need to ovulate consistently every single month.
Mm-hmm.
So you have to be sure of when you're ovulating. If you're not sure, then you can buy the test strips and then test for a few months until you're sure that, okay, I'm consistently ovulating on day number 14 of my cycle or day number 16.
Mm-hmm.
And so once you know that you're ovulating around this time, then don't engage in intercourse around that time. Or you can use some protection or other methods to ensure that no sperm gets in. This is
Okay.
a way that I recommend, but of course you have to be disciplined. More about this.
I'm
This is
behaving
that this isn't something that I push on people.
Yeah.
While I recommend it, I don't push it on people because you have to be very, very diligent, and you have to be able to resist the urges in the moment, or make sure that you have protection with you or something else.
Mm-hmm. Okay. Awesome. No. I'm much better than I was back then. So it's working. It's working.
Okay.
I'll just read a couple of messages from our viewers. Someone was asking, how about going on periods twice in 1 month? What will be going on there? This is coming from Doreen Gwanzura.
Hi, Doreen. That will be a serious problem hormonally. So your hormones are imbalanced. I would need more information about that. So when you go, is this like full bleeding for 5 days? Twice, like 5 days you bleed and then you just take a week off and then you bleed another 5 days? That's a problem. That's a problem. But a lot of women go through that. A week doesn't go by without people saying that they have that particular issue. So if you bleed for, like, your period is consistent, you bleed and then you stop, you need to have a gap of about at least 3 weeks, about 3 weeks or so before you bleed again. If your gap is just 1 week or 2 weeks, then that's not ideal. Yeah. So you need to have time. You need to have a few weeks in between when you stop bleeding, or 3 weeks. between when you stop bleeding and when you start bleeding again.
Yeah. I can also imagine for our blood supply, that is very unhealthy as
That
well,
is
right?
very, yeah. Talk about anemia, and lots of other like depletion of nutrients as well.
Yeah. Okay, so thank you so much for that response. We've got some comments coming in. Great topic, indeed, answered my questions. Thank you. That's Doreen again. She mentioned that earlier. And then Slevy saying, great lesson. Thank you, Janet and Doug. Yay! Hey, Janet. Hi, Edith. And then Edith says, this is when you were talking about how men can support us during the period. So she's like, I like where you're going with this, Doc. And then we've got Madrine Chiku, who said this is powerful and she's loving it. So I wanted to just say that this session of our discussion with Dr. Vita was focusing a lot on our reproductive side of the menstrual cycle, when we want to fall pregnant, the optimal health and things like that. We're also going to have another session with Dr. Vita sometime in September. We'll be talking about young women, girls and young women, and how they can start thinking positively about their menstrual cycle as well, so they don't have the love-hate relationship that some of us grew up with, and they can learn to love their cycle. Another comment from Rosalind Williams, which says, thanks for the great life-changing information. And Doreen says, thank you, Doc. I think we responded to some of her questions. Probably she'll want to engage more on the side. But thank you so, so much, Dr. Vita, for making the time, for being here with me, having this conversation, talking to all of us out there, and educating me that my period is a gift from God, and I will treat it with more respect. Ooh, yes. So stay tuned for our second bit in September, part 2 with Dr. Vita. And yes, great stuff. Oh, answer great stuff, Murora. Doc does answer a lot of questions. And someone just commented as well, relevant topic. So thank you, Dr. Vita. Enjoy the rest of your day. I know your day has just gotten started. So thank you for making the time. We love you and take care.
Thank you.
All right. Goodbye. Goodbye. Thank you to our viewers.